So you're having knee pain and your MRI report comes back saying you have knee osteoarthritis and you are bone on bone. No, this does not mean you need to rush off and get a knee replacement, but if not that, then what? Not quite sure where to go from there? Well, listen up as I take you through what knee OA is, what it means, and what it doesn't mean, and more importantly, what exercises you can do to help. Hey Prehabbers, welcome back to the channel. Dr. Adelle here, and today let's talk all things knee OA. Oftentimes we see patients who come into the clinic or reach out to us with an MRI report or x-ray that reveals they have knee osteoarthritis and they aren't quite sure where to turn in regards to treatment of their symptoms or what they should even be doing or what that diagnosis even means. So let's talk through it together. To begin, let's talk about the knee joint itself. The knee is a tricompartmental synovial joint, which means that it is designed for movement. Lots of movement in our knee joint. So synovial fluid helps lubricate the joint to help assist with fluid movement between the two bones or surfaces, as well as provide nutrients to the joint. These types of joints typically also have a layer of cartilage in between the corresponding bones to help guide that movement as well as add another layer of protection. However, these joints are also more often susceptible to the onset of arthritis. And that's likely why when you ask around, people tend to have arthritis of similar joints, like the knee, hip, and shoulder. So what exactly is osteoarthritis? Well, when we break it down, the word osteoarthritis quite literally means inflammation of a bony joint. Who would have thought? But it isn't always that simple. Like I mentioned, the knee joint is tricompartmental, meaning that there are three compartments that this can occur in. You have two tibiofemoral joints, so you have the medial or the lateral side and the medial side, as well as your patellofemoral joint, right through here. So it is important to note that some arthritis can be in just one part of your knee, which means that your knee is not totally Another important factor to note is that osteoarthritis is very common and normal and often asymptomatic. It is often a response to too much stress on the knee, which is why we see it more as we age or often after a major surgery. However, sometimes this inflammation in our knee can cause pain, and that's likely why you've tuned into this video today. But before we go run off to get that knee replacement, it's important to remember there's a lot you can be doing to help manage your knee osteoarthritis symptoms, including, you guessed it, exercise. So let's dive in. Several studies have shown that the introduction of aerobic exercise in the form of walking or using a stationary bike can be beneficial in managing pain associated with OA, as well as improving functional capacity, meaning your ability to continue to partake in everyday activities. This includes walking, swimming, and biking, and dare we even say it, maybe even a little bit of jogging. The key with aerobic training, even if it is light activity like walking, is remembering it still causes stress on the knee. Now remember, stress can be good, but too much stress is what we are trying to avoid. So make sure you are ramping up your aerobic training in a controlled manner. We suggest somewhere between 5 to 10 minute increasing intervals every 2 training sessions to start. Next up, let's talk about the do's and don'ts of strength training. When it comes to exercise, there are 2 treatment strategies we know are beneficial in regards to improving function and managing pain for those with knee OA. And that includes aerobic training and strength training. And if you stick around to the end, we'll even go over our favorite knee stretch to help with that pesky knee stiffness that often accompanies knee OA too. When considering your strengthening program for your knee osteoarthritis, it's important to start out and remember that any exercise, even if it's the tiniest amount, is going to be better than no exercise at all. And we also want to consider what our exercise is doing, what muscles are they working, and how are they helping us as far as our knee health as well as our quality of life. One of my favorite exercises to start with is going to be a traditional squat with just our body weight. No additional weights because we don't want to overload that knee joint to start. So what you want to do is just set yourself up in a nice wide position, just about hip width apart. There's a lot of different variations. People always say knees should be straight forward. I usually say whatever feels best for you is going to be your best starting point. So if you want to let your feet turn out a little bit, you can do that. Squat down, keep your chest tall, and sit your hips back like you're sitting in a chair. Remember, while these might seem really straightforward, a lot of people who suffer from severe knee arthritis actually have pain with day-to-day squatting. That means picking up something off of the ground. That means maybe getting up from the dining room table, sitting down on the toilet, or getting in and out of the car. So this movement is really, really functional and important to master. If you're noticing that maybe your depth is a little bit limited, you can't get all the way down, or you feel off balance, I love using a bench or a chair behind me just to kind of give us some feedback as far as how low we want to go. Tap, and can come back up. And if that's still too challenging, we can turn it into a sit to stand. Again, super functional. We sit and we stand every single day. So you're gonna sit all the way down, let your weight plop down, and stand right back up, all right? When we're doing this, keep in mind where our feet, don't put them super far out in front of you. It's gonna be impossible to get your center of mass all the way over your base of support. So bring your base of support closer in. So that means bring your feet back, center of mass, nose over toes, and stand on up. And apply that as you progress from your sit to stands to your squats. The other reason I really like squats is actually because they're a really good entry point to progress to more challenging body weight exercises like lunges and step ups and even step downs. So start with your squats, go to your sit to stands if you need to, and then work your way up to lunges, step ups, and step downs. From there, we've talked about squats, which work your hamstrings, your quads, your glutes, which is obvious, right? We want to strengthen the muscles right around our knee. But it's also important not to neglect the muscles that are a little bit lower and actually do a lot of support with walking every single day. So that means our calves. So what I'm going to suggest we start with is just basic old calf raises. Starting, making sure you're feeling supported, going all the way up on your toes and back down. People try to do this unsupported. I think when we're really focusing on strength-based exercises, it's important to take the balance out of it. That's a whole other thing we can work on, but strength-based exercises, give yourself the support you need to really maximize the efficiency of your movement. So what I would say, grab onto something, make sure you're driving through the ball of your foot. Try not to go onto your toes, really activate through the ball, sometimes making sure you can actually wiggle your toes at the top and come back down. You can start with 2 legs. You can make it more challenging by going to 1 leg. You can make it more challenging by going through more range of motion by adding a step. So you're standing on a step, let your heels drop and come back up. But the more you drive through your toes, the less you're actually using your gastroc and your soleus, which are the muscles that work the most during your gait cycle. So every step you take, your calves are the predominant muscle that are helping with shock absorption. So calves, quads, glutes, hamstrings, got those covered. And of course, no functional program would be complete without thinking about our core. Some people think, why does my core even matter when we're talking about my knee? But it can affect your trunk position, which can therefore affect where your hip is and therefore your knee alignment. So my favorite go-to core exercise, anything relating to the knee, is going to be a side plank, which I know isn't everyone's first go-to, but I think it's also important to remember there's lots of different options. So don't restrict yourself to the traditional side plank on the ground. If you want to, you can go on your hand or your forearm. But if that's really difficult for you, you always have the option of using a bench, going into an incline and making it more challenging here. Adding leg lifts, adding knee drives, and then if you want from there, you can drop down to your knees or a full side plank from there. But again, everything to tolerance, and remember, our body is working together to stabilize and to strengthen and get that knee stronger. Next up, we have isolated strengthening exercises. We touched on the importance of functional exercises, but what if those just aren't really an option, or what if you want something else to add on? That's where isolated strengthening exercises come into play. Some examples of isolated strengthening exercises include leg extension, so sitting up, straightening that knee out, whether it's with ankle weights on or you're at the gym and have a leg extension machine, or doing the same thing with a leg curl machine at the gym, or lying on your stomach or standing and curling up to work on your hamstrings. Both of these types of exercises are really helpful, especially if your knee is really sensitive to weight-bearing activities like the squats that we went over, walking, jogging, and maybe cycling and stationary biking are the only things that your knee can really handle right now. That might be an indicator that weight-bearing exercises aren't quite where you're at yet. These exercises are a great way to bridge the gap, continue to meet your strength goals, and create an overall healthier knee. Last but not least, we've made it to the pain relief and stiffness part of our video. Promise I wouldn't leave you guys hanging, so we're going to be going over my favorite exercise to help with that knee stiffness that often accompanies knee arthritis when we're trying to work on bending. However, if you're noticing you're more limited in knee extension or straightening of your knee, I definitely recommend checking out our knee extension overhaul program, but this exercise is going to be a winner when it comes to knee flexion and bending. And it looks like an exercise you might have already done. Very, very simple, straightforward child's pose, but with a little bit of a knee flexion bias. So all you're gonna need is a rolled up towel. Depending on how much flexion you have available will dictate the size of the towel that you need. So if you're really, really limited, a larger towel might be necessary. If you're pretty good, just kind of missing your end range, a smaller hand towel will do just fine. All you're gonna do is position yourself in your child's pose position. If you are noticing that you already have some tenderness on your knees just from kneeling, go ahead, grab a pillow, a foam pad, something along those lines to give you that extra cushion. You're gonna take that towel and you're just gonna jam it right into the back of your knee. As you kind of hinge forward and end up going into that child's pose, try not to let that towel slide out. The closer you keep it in that knee joint, the more it creates a gapping sensation, meaning kind of an opening sensation in that knee joint to allow you to sit back a little bit further. Once you're here, you have a couple options. You can either just hold it like you would a regular child's pose. That's going to be a nice static stretch. Or you can turn it into a dynamic stretch where you're moving in and out of that motion. But remember, again, the key here is the towel roll. So go ahead, try it out and let us know what you think. So let's review. Studies have shown that when looking at intensity of exercises to help with knee OA, lower intensity exercises such as stationary biking or going on a quick walk, and higher intensity exercises such as doing more of a strength-based routine or even some light jogging are all equally as beneficial. It's all about tolerance. When it comes down to it, when dealing with knee OA, any form of movement is going to be good movement in regards to pain management and improving your ability to continue to do what you love on a day-to-day basis. It may not reverse the osteoarthritis, but it sure can help and will increase your quality of life. Now, there are a lot of other avenues worth exploring as an adjunct to exercise, like a weight loss program, dry needling or acupuncture, and even some injections to help increase the synovial fluid and therefore lubrication of your joint. So we recommend that you reach out to your PT and care team to discuss further options. And remember, if you're looking to take the guesswork out of your knee rehab and strengthening program, let us help. Check out our knee rehab program here, and we'll see you guys next time. Bye, Prehabbers.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.